Hello friends, welcome to Dream PG YouTube channel. This channel will discuss about high yielding and most repeatedly asked questions for those who are preparing for medical PG entrance. If you didn't subscribe our channel so far, please do it and click the bell icon next to it to receive notifications. Feel free to click the like button and share your comments. Hello friends, welcome to Dream PG YouTube channel. Today we will discuss about brucellosis. Brucellosis is caused by Brucella melitensis. It is a gram-negative coccobacilli. Other important features of this organism are it's a strict aerobe, it's non-motile, non-capsulated and non-sporing. Other name for brucellosis is Malta fever or Mediterranean fever or undulating fever. Most common characteristic feature of brucellosis is musculoskeletal pain. Brucella is used as an agent of biological warfare. Major virulence factor seen in Brucella is lipopolysaccharide. The definitive diagnosis for brucellosis is blood culture. Here the culture is done in trypticase soy broth. Castaneda method is the specific method for brucellosis detection. Here we use a biphasic medium. The liquid medium is the bile broth and the solid medium is agar. The substance erythritol have a stimulating effect on the growth of brucella. It is transmitted from the raw milk. Brucella produces cross reaction with Vibrio cholerae, E. coli, Salmonella, Francisella tularensis. It also has a characteristic cross reaction with guinea pig. Let's solve this question. All are true about brucella except option A, gram-negative coccobacilli, option B, strict anaerobe, option C, it causes undulant fever, option D, trypticase soy agar is the culture medium. Yeah, that's it guys.